My interest becoming a physician, and more specifically an orthopedic surgeon, really came about as a result of playing a lot of sports in high school and college, and enjoying spending time with people. Looking at medicine, I wanted to find something that I could help people with, stay away from chronic conditions that I really could not make better. And since sports was what I liked and I played in high school and college, I chose orthopedic surgery. I grew up in Mettman, which is a small, quaint, wonderful town about 45 minutes from the shore. I used to visit the Jersey Shore in my summers. So I've always enjoyed the Jersey Shore. A few years after I had started practice in Jersey, myself and my partners got very involved with an entity called Save Our Shores, which we were trying to help clean up the ocean. It has grown. Save Our Shores is no longer the entity. There are other entities that have taken up the banner. But being able to participate in something that makes the shore more healthy for people is very enjoyable. In dealing with patients that have orthopedic issues, it's first important to establish how their condition affects their quality of life. And what do they expect to get out of it? What are their goals and aspirations? Because you have to have a very good relationship with the patient. It's a two-way street. It's 50-50 between you and the patient. You can prescribe as much as you want, but if the patient is not going to adhere to the protocol you want, such as losing weight or stretching exercises, then you're really not going to have a good outcome. Recently, there's been a lot of information about running. And in the last couple of years, many marathons are run and patients are very involved in the running process. And it may not be all it's cut out to be in the literature, the continued impact loading. So if I have a runner that's a marathon runner, obviously I have to slow them down a little bit if they're having problems. But what I really emphasize is flexibility, core strengthening, a good diet, and doing aerobic exercise, non-impact loading. Walking is fine, bicycle, swimming is great, things like that. Again, when making the decision about joint replacement, whether it's knee or hip replacement, again, I point to the patient's quality of life. What do they expect at the end of the procedure and when they finish recovery? Of course, you have to exhaust conservative treatments, weight loss, anti-inflammatories, trying different types of injections, occasionally physical therapy, until you come to the decision that their quality of life is significantly impacted by their ailment, be it arthritis in the knee and hip. And then to let them know that what they can and can't do afterwards, even if they have a totally successful recovery. We really don't want patients with joint replacements to do repetitive impact loading because it can loosen the prosthesis.